Hello, my name is Henry Geiter, and I'm in the BSM program at St. Petersburg College, and I'm doing my community analysis presentation on New Tampa, Florida, the community I chose. Before 1980, it was mostly farmland, some scattered housing developments that were not contiguous, and it was all unincorporated Hillsborough County. Very little real estate taxes and such were there because there was very little real estate to be taxed. Most of it was open land or public land. Then in 1985, Tampa Palms community was being developed, very, very rapidly growing, and was kind of haphazardly being developed. And New Tampa saw the opportunity to annex the area and bring in some real estate money. Annexation allows bringing in funds that weren't available before, and that allows them to grow their economic base rapidly. Rather than raising taxes, they can add new property. In 1988, they decided to annex Heritage Isles community. This was not in a contiguous area. It did not abut any part of Tampa, but under then current law, it was permissible. Between 1988 and 2000, there were other areas that were annexed, small pieces here and there, but there was a law that was passed that changed it so that you had to have all the annexed areas were contiguous or connected or abutted the current location that you were annexing from. So in the year 2000, Tampa annexed the Star property, which contained a sliver of land that had separated Tampa Palms and Heritage Isles and made all the Tampa community and in the annexed areas one contiguous location. Between 2000 and 2013, annexation continued, and even till today, there's 150 acres under consideration by Tampa to be annexed. The needs of the residents. Annexation is a bad way to grow. The Orlando Times staff wrote an article that discussed Orlando's growth pattern and how they should learn the lessons from Tampa. And then the sprawl and the haphazard growth pattern of annexing a piece here and a piece there without having the infrastructure developed, or without planning and saying we need to develop infrastructure here because in the next 5 or 10 years we like to annex this location there, and having some plan to be able to meet the needs and meet the infrastructure needs and the social needs and the services needs like water, sewer, and electric. And so Tampa, according to this article, has been a growing in a very haphazard way, and it's hard to maintain. Roads and transportation are an example of that. It seems that their constant expansion is necessary. Bruce B. Down, a major thoroughfare through the heart of New Tampa, started out as a 2-lane road, then went to a 4-lane road, 2 in each direction, then a 4-lane road with turning lanes, and now it's up to 4 lanes each way with turning lanes for right and left turns. All this was happened multiple times. Matter of fact, the entire time I've been in the Eastern Park subdivision, which is going on a decade, there has been constant development on Bruce B. Downs Boulevard, and it's no end in sight. Some poor condition roads due to the high volume. Morris Bridge is a 2-lane highway, a 2-lane road that's pretty much an expressway. There's no traffic lights for 7 miles as it goes through the nature trail area, Flatwoods Park, and goes up through some rural areas where there's mostly farms. This area was meant to be low volume traffic because it was a farm area, but with the expansion of Cross Creek and the expansion of Bruce B. Downs, people now use Morris Bridge as an alternate route, and it's getting much heavier traffic to the point where there are times where on the 7-mile stretch I can spend 15 minutes driving that bumper to bumper traffic on the way down to Interstate 75. There's no bus service or rail service. There's no additional support structure. It's all by vehicle or by bicycle. Anybody who lives in Florida knows bicycle in the wintertime, great. Bicycle in the summertime, heat stroke. So we need some kind of infrastructure to help with transportation of people who don't have cars or who don't wish to use cars, and try to improve the congestion and the environmental impact. Some apartment rentals are available, including some lower income areas, but there's not a huge amount. And this is a problem because most of the construction now going on is new housing, higher end housing, $200,000, $300,000, $400,000 homes in gated communities. And it seems to be squeezing out even the lower middle income people. The people making $100,000 a year can't afford a $500,000 home in a gated community, even if both parents work, if they have kids. So this can be a problem. The new housing construction itself is a problem, which we'll talk about a little bit later with the environmental portion of the lecture. New stores are being built and new infrastructure. Doctors' offices are popping up. A new Walmart was built on State Road 54 just north of the border. There's a freestanding Walmart superstore already. There's banks popping up and merging and developing. There's Publix in multiple locations within 5 miles of one another. So there's lots of stores and lots of infrastructure there. In addition, new hospitals. Just north of the County Line Road border for New Tampa, they've installed a new Florida hospital, Wesley Chapel. And the Florida hospital, Tampa on Fletcher, which is about 10 miles south of the center of New Tampa, has expansion. It has the Pep and Heart Center. Between the two of them, they have open heart surgery. They have the capability of doing obstetrics, gynecology, neonatal ICU, pediatrics, trauma, and all these wonderful things. So the services that are being rendered for this particular location is helpful. New Tampa demographics are younger than the state of Florida. 30% are under 18, 24% in Hillsborough County are under 18, and 21% in Florida are under 18. Now, this is an important demographic because what it is showing is that the younger generation or people who are having lots of children are moving into the area, which is going to impact my prioritization for some of the things that need to be accomplished. There's only 7% older than 64 versus 18% statewide, which is also an interesting demographic, and it's very easy to see the younger generation and give the younger infrastructure, but elder services are going to be an important part of growing the area because these people will be here for a while and age, and having that infrastructure for when the 7% becomes 8 and 9% later on is important. Rapid growth. According to the Wesley Chapel Chamber of Commerce, the population has more than doubled in the last 10 years and currently sits at 55,000. Now, there are some numbers that are lower depending on the strictest definition, but when you include some of the areas that are under consideration for annexation or are currently being annexed since the last census, 55,000 is a reasonable number. Racial diversity is another important thing. 66% are Caucasian and 75% statewide are Caucasian. And this includes, for the New Tampa area, 15% are of Asian descent versus only 7 to 8% county and statewide, respectively. This gives a much better diversity, allows children to grow up in a more diverse community, be at school with peers who are come from different cultures, and is generally good for the area. Income, low poverty level, less than 9% are under the $24,000 poverty level versus more than 17% statewide. This is an important statistic. It shows that we have upwardly mobile people, but it also shows that we need to really get into knocking down walls to help those low poverty people. Just because they're a small percentage doesn't mean they're non-existent. Health resources, the access to health care. ACS 3, the increase the proportion of persons with usual primary care provider. Primary care providers are important, and having a consistent one is important to keep track of the records, to make sure that there's no medication problems, no duplication of medication, giving somebody Coreg and low pressor, both when they're both beta blockers, to make sure there's no problems. And if they use different pharmacies, that can be missed. It also gives them the opportunity to develop a trusting, bonded relationship and allow them to trust them on things like childhood vaccinations, adult vaccinations, preventive care like flu and pneumonia vaccinations and meningococcal vaccinations. All these things come from developing a relationship, and having a usual primary care provider is important. EMC 2.4, increase the proportion of parents who receive information from their doctors or other healthcare professionals when they have a concern about their children's learning, development, or behavior. This is an area that can be filled by nurse practitioners. We can expand the pediatric practices of physicians to include nurse practitioners who can do this as part of a screening program. This also can be something that can be done in a community center, where if there's a daycare center, we can have parents can be offered the opportunity to meet with a nurse practitioner who specializes in pediatrics and child growth and development, and they can learn about the developmental milestones that their children and the age ranges. So some kids may not be saying words at 1, and some kids may not be speaking until they're 4, and whether that's normal, abnormal, any testing that's necessary. And so they can be their primary care provider, but since a lot of them in the area are going to be maxed out, they're no longer accepting new patients because their practice is so busy. Getting nurse practitioners involved would be a great way to solve this. MICH 19 developmental, increase the proportion of women giving birth to attend a postpartum care visit with a healthcare worker. Postpartum is important. The process of giving birth, seeing the baby, getting that first interaction with somebody who can help you understand some things about a newborn child, especially a first child, is important. You need to be able to learn how, make sure that they know how to latch on, if they're good at breastfeeding, how to handle issues like colic, developmental milestones, normal behavior. Isn't typical for them to throw up. What should the stool look like? All these things can stop parents from overreacting, calling their primary care provider, or if they don't have a pediatrician because it's their first child, going and clogging up the walk-in clinics in the ER. So getting them involved with healthcare and develop a trusting relationship with a healthcare provider after the baby's born is going to help the child, the mother, and the family unit in general. The environment of New Tampa. There's a program that Tampa has developed that's diverting food waste. The Environmental Protection Agency said that in 2015, more than 50% of our waste stream going into landfills is food waste. Orange peels, apple peels, bad food. Now, some of that is rancid meat and stuff that can't be recycled, but food waste, like the things that we used to do in garbage cans when I was younger up in Philly, and we put peelings, potato peels, apple peels, celery that's gone bad, or cucumbers that got mushy, and we would put them in the garbage pail, and they get collected and taken to a composting area. They're actually looking at turning it into compost or turning it into soil and reusing it in the environment instead of trapping it in a landfill where all those nutrients and all that benefit is wasted. Recycling. Everybody in the New Tampa area gets a blue garbage can. That blue garbage can is dedicated for curbside recycling. That's where glass bottles, plastic bottles, newspapers, cardboard all go in there. And then they get picked up, they get taken down to the dump, and they get put into an area where they're separated by mechanical means and put off into the correct areas to be recycled and reused. Now, this is important because it reduces the amount of waste products in the area, and it also allows them to decrease use of natural resources. Pollution in the local area. There's a number of ponds and lakes and small streams that go through the communities. These are not monitored by the state or the local government, and therefore the problems can occur with pollution. There can be wrappers, there can be runoff from fertilizer being used in backyards, rain, excessive fertilizer use can drain into the ponds and cause blooms, and these small areas of pollution can turn into big areas of pollution. In addition, construction waste. All these new houses, you have sheetrock and wood and nails and concrete blocks. But not only that, you have some unusual waste that I've seen for the first time in my life. Is we have a very large mound in our subdivision of dirt that we dug up from different areas to build ponds, retention ponds, foundations for houses, and it stands well over 100 feet high and a football field long, and it just sits there growing little weeds here and there. Can be a source of standing water for mosquitoes to breed, and it can be dangerous for children who are unfamiliar and can try and climb up it and slide down because it is simply a pile of dirt. Public policy. The economy of New Tampa. New Tampa is basically annexed from Tampa, so whatever Tampa's economic situation is, so is New Tampa. But New Tampa is Tampa's engine of economic growth. It's if you raise taxes 1%, you get only 1% money back. You only increase your income by 1%. But if you add 1% of new properties and can tax them at higher rate because they're higher end, now you get a much larger percentage return on your investment. So annexing brings in brand new real estate property taxes, brand new city taxes, brand new sewer fees, brand new water fees for relatively small infrastructure costs. So we are driving Tampa's growth. Tampa annexes an area, gets lots of money from the people in that area, and then takes it to spread it out all throughout the city. But the accessibility of the officials is a problem. Tampa's officials are New Tampa's officials. There is no independent governing board, no board of governors, no county commission, no city commission, because we're part of Tampa. So we have a problem there. We generate huge amounts of income for the city, disproportionate to our size, but we also get representation proportionate to our size. So people come and we give money and they go spend it somewhere else, but we only have a small say in the amount of money that comes back to our community, but we have a large say in how much money we give. And this comes down to the concern, political representation. We need some kind of representation that is proportional to the impact that we're having on the economy. As they annex new areas, each new area bringing in millions of dollars in new revenue should be able to have a substantial say in the direction of that money. And this isn't the case. I'm not sure how to make that happen. The community needs. Elder care I put first because it is an underrepresented compared to the state. The state of Florida is known for retired people, and so elder care is focused, but in the New Tampa community, the very low percentage of people who are over the age of 65 can put them in a disadvantage. A lot of the infrastructure is for the younger generation. There are discount malls. There's Wiregrass Mall, which has Hot Topic and stuff, and has a lot of stores that cater to the younger middle class clientele, because that's the percentage of people that are there. So it's very easy for elders to be missing out. The hospitals are of course able to take care of the elderly, and a large population of their patients are, but getting infrastructure or getting doctor's offices and getting services that help them, and getting ACLFs, ALFs, nursing homes in the area to help care for those people, those things aren't in the area, and that's something we need to work on. Immunizations. The large percentage of children under the age of 18 is a good indication that immunizations are going to be an issue. A large number of parents are immunization hesitant, and so we need to really push for it so that we don't end up with an outbreak of measles like they had out in California, because there was a large population of children who were under-immunized. Low-income housing. I put this third because I think it's important, but it's not as important as health and safety of children and the elderly. But low-income housing, making sure that there's safe and affordable housing, that they don't have to live in bad environments or rat holes in case they have some kind of problems, or if they're trying to be upwardly mobile, get them into the community at a lower income and then develop themselves once they're in. Transportation, not quite sure how to solve this one. Buses really won't help because we really don't go outside the area very much except to work. And light rail is really kind of out of the question, very expensive, and there's really no place to put the stations that are going to be feasible and usable for people. But the congestion that we have on the roadways right now is unacceptable and is causing problems, delays, people being late, larger numbers of accidents. So it's something we need to look at. And that goes into the growth plan. If we have a proper growth plan, transportation would come off the list, because we would be building the infrastructure and only allowing the growth to happen that would be supported by that infrastructure. We wouldn't have to keep expanding road after road after road. If we said this is the maximum number of houses in this area, we'll need a 4-lane road this way with turning lanes in the center, and once we build those turning lanes, we'll build the area, and then we're done. So we need better growth plan. And finally, the lowest one I think is unemployment, or better put, underemployment. A lot of the area locations are restaurants or retail stores or Walmart or Target, where the income level is relatively low, or they may actually be part-time job here and a part-time job there and not qualify for benefits and have to pay their own benefits. So addressing the unemployment issue or the underemployment issue, and trying to get businesses that pay better, white-collar businesses, to come up here and not have them all downtown Tampa. Get some of them to come out to suburbs, give them some tax breaks, get them to move out here so that they can better get the people to have the jobs locally so they don't have to drive the interstates, decreases the congestion, makes everybody happier. Finally, the global issue that I chose was immunizations. It is a local issue. It's a local problem. American parents are on a trend away from thinking immunization is good, and there's a lot of things that other countries are doing that we can do to help. Number one is school-based programs. It's important for kids to have school vaccinations before they enter school, but what happens if they're in kindergarten and before they start first grade, they have to have immunizations? Why not offer them to the kindergartens there? Have a nurse practitioner come in, set up a clinic so that all the parents, all they do is sign a form. Their kid can come over, they can get their immunization, they can be watched in the office for a little bit and then return to their classroom. Or it can be an after school or before school program. So any kids who are staying after school or on the free lunch program and get support after school because their parents are working, then maybe we can do it for them. Study after study shows that this improves the immunization rate. Supplements to make the immune system better and stronger, make the immunizations work better, has been proven to be effective. Effective vaccine management, making sure that there's enough vaccine available, making sure that it's distributed equally, making sure it's not cost excessive. And then we can get school-based programs and other ways to develop them. But they have to be refrigerated, so having proper storage facilities locally so that they can be distributed to the doctor's office quickly. And a Journal of Nurse Practitioners suggests primary care promoting the acceptance of vaccines in the hesitant parents. Parents come, and if they have a usual primary care provider for them and or their children, that primary care provider can promote the use of vaccines. If the parent is hesitant, studies have shown that hesitant parents can be converted at a very high rate to parents who are accepting of vaccines if they have a trusting relationship with a primary care provider that they see regularly and who takes the time to explain to them. With doctors spending lots and lots of time with the insurance companies and billing information and patient issues and calling in refills, perhaps a nurse practitioner can be added to the practice to handle just the immunizations and just the conversations about that. And finally, rural outreach programs. Let's take the vaccines to the rural areas. Those are the kids who may not get vaccinated. They may not be in school. They may be homeschooled. They may work on a farm. It's sparsely populated, so it's not like you can go to a community center. Drive out, knock on the door, drive around, see if there's kids around. And when there are kids around, find out where they congregate, and then go there and talk to their parents. These are all ways that have been shown in other communities and in other countries that have been successful in increasing the immunization rate. Thank you for your time and attention, and that concludes my presentation. Thank you very much.